I want to get to our Bloomberg contributor, Mark McClellan, who is also a former Medicaid administrator, to get some more thoughts about this historic moment, really, for healthcare reform and for the country. Mr. McClellan, I mean, listening to Obama, certainly we are very close to getting national health care reform, but there are still plenty of hurdles. The biggest one, in your opinion?
There are a number of hurdles to get the bill through conference. There are a lot of differences that have made the news, including the fact that the House bill has a public option in it and the Senate bill does not, including that the Senate bill has a provision to start taxing very high-end, costly health insurance plans in an effort to help keep health care costs down and to pay for the bill. But there are a lot of other provisions that differ, too. Provisions like abortion, how generous the subsidies are. All those are going to have to be worked out, and you just heard a president who sounds like he's going to be actively involved in getting this to closure.
Yeah, and a public option, getting to your first one, which has gotten the most amount of press, even the president seemed to suggest that it is not going to be a must in this.
The president's been pretty clear that he does not have to have this. He's recently been emphasizing how much else is in the bill to help assure that people have access to good health insurance and to bring costs down. And with really no margin in the Senate, this was passed with every single Democratic vote and no Republican support. It seems unlikely that the public option is going to make it into the final bill.
In your view, having been in this issue for so long, should the president have been tougher on the health insurance companies?
Well, there are a lot of provisions in this legislation that the health insurance companies don't like. One of the provisions basically regulates how much of their premiums can go to things other than paying directly for health care. That seems like a good idea to the president. He's emphasized that this is a way that he's going to hold the insurance companies accountable. On the other hand, what the insurance companies argue is that they're doing a lot of things now through wellness programs, through giving people better information about how they can lower their health care costs that are going to be more difficult if this tightens up. So there's a debate about how good of an effect the steps that he's included in the legislation that he's pushed for and is going to be pushing for in the final legislation will actually have. But there are definitely some provisions that the insurance companies don't like.
Right, and I'm looking for a simple answer to a very complicated question, Mr. McClellan, which is, are we going to see costs become more efficient in health care here?
According to the congressional budget experts, the answer is no. Overall, health care costs are still going to rise. They're going to rise a little bit more rapidly than under current law because of this legislation. But that is one of the big unresolved issues at this point. There are a lot of provisions in this bill that could help bring health care costs down. It's going to be some real work to implement them. It's going to take a new way of doing business in the government. It's going to take some major new steps to give people better information on what works and to help them use it. And that's going to be one of the biggest challenges of implementing this major new law.